once again, welcome to our press briefing ng Bangsamoro Interagency Task Force on COVID-19. So, to officially start, I request the Executive Director of the Bureau of Public Information for Atuan.
Bismillahirrahmanirrahim. Amin Rabbil Alamin. Alhamdulillahi Rabbil Alamin. Rahmanirrahim. Iyyaka na'budu wa iyyaka nasta'in. Ihdinas siratal mustaqim, siratal ladzina an'amta 'alaihim ghairil maghdubi 'alaihim waladdallin. Rabbana zalamna anfusana wa lam taghfir lana wa tarhamna lanakunanna minal khasirin. Rabbana ighfir lana wa sabir mustaqim aqdamana wa surana Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzaban nar.
Before we start, I'd like to thank all the media na nagpunta po, our partners from the media, despite the threats na meron tayo ngayon. So we have here seated for the press briefing the Minister of the Ministry of Health, Dr. Safrula Tipatuan, the Cabinet Secretary and the spokesperson of the Interagency Task Force of COVID-19, Sir Astin Pendatul. We also have Deputy Minister of the MOH, Dr. Zulkarnain Abbas and Dr. Usman of MOH2, and we also have here the Director of the Bureau of Public Information. So without further ado, I would like to turn over the floor to the spokesperson of the BARMM-IATF to give us updates on the COVID situation in the Bangsamoro Autonomous Region in Muslim Mindanao. Sir?
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Ganda at pagpalayo at magaw sa ating lahat. First of all, allow me to thank our friends from the media for placing this press briefing of kaya mo na nabanggit niya kasi kanina, despite the risks of coming here today. And we ensure that we have in place po yung mga guidelines with regard to the conduct of the press briefing patungkol po sa physical distancing. Kasi we notice, meron din tayo mga additional na health schemes sa labas. To begin this press briefing, allow me to share to you yung brief kung ano po yung mga naging action na ako ng Bangsamoro Interagency Task Force. Some of the substantial ones. On March 14, 2020, the Bangsamoro Interagency Task Force released a comprehensive guidelines aimed at protecting its constituents against COVID-19. Ito po, pinalabas po natin ng Friday. Nilabas at kinaskate na rin po ito sa iba't ibang opisina, maging po sa LGU ng Bangsamoro Autonomous Region in Muslim Mindanao. BARMM, through its Ayuda Medical mula sa Bangsamoro Government or yung AMBAG, a banner program of the Office of the Chief Minister will cover the expenses of possible COVID-19 patients in the region admitted at any of the following hospitals. Sa Basilan ho, yung Basilan General Hospital, in Cotabato Regional Medical Center, sa Marawi, ang may Pakpak Medical Center, sa Maguindanao Provincial Hospital, in Sulu Provincial Hospital, and in Tawi-Tawi, yung pong Dato Halong Sakilan Memorial Hospital. Ang BAG currently has 11 partner hospitals. Yung 6 po na nabanggit kanina, ito po yung identified by the Ministry of Health as in accordance with DOH Public Advisory Number 13 as referral hospitals kung saan ho sila ho yung may kakayahan at mandated to treat yung mga PUIs. All other AMBAG hospitals, gaya po ng Buluan District Hospital, Dato Blasing Swat District Hospital, Sanitarium, Serapio Montaña Hospital, shall refer po yung mga patients exhibiting COVID-19 dun po sa 6 hospital na nabanggit. Mula po nung tinatag natin yung AMBAG, meron na po itong more than 2,000 beneficiaries kung saan karamihan po sa kanila ay na-discharge or umalis ng hospital without paying a single centavo. Again, yung partner hospitals po natin sa Ambag, continue pa rin ho yung ating operation. We actually made several adjustments. Before po kasi, we really required them to visit or go through our desk officers and have endorsement letters. But in view of the physical distancing, magkakaroon po ng adjustments in such a way na we will just coordinate with the hospital. Especially po dun sa Cotabato clients natin, no need to visit the office of the Chief Minister para po dun sa endorsement letters. Everything will be done at the hospitals and this will be coordinated accordingly. On March 17, the Bangsamoro Mufti, Mufti Abdul Hurairah Udasan and the Regional Darul Ifta released a fatwa urging the imams of the mosque all over the BARMM to have dua or kunut on congregational prayer Friday Subuh prayers. But on March 18, or March 19 rather, all offices within the Bangsamoro Government Center have undergone wide disinfection. This is on top of the regular disinfection of the different offices and workplace pursuant to the BARMM guidelines on COVID-19. Yung pong regional Darul Ifta natin, nagkaroon po ng subsequent proclamation or pronouncement in which temporarily suspend yung conduct of congregational and Friday prayers until April 14, 2020. Ito po ay in consideration of the COVID-19 pandemic and we urge everyone to take this opportunity to disinfect po yung mga masjid natin and at the same time yung community surrounding it. Noong March 18, nagkaroon din po tayo ng media briefing kung saan po nagbigay tayo ng mga importanteng guidelines and status of COVID-19 in the region. As promised, dapat pong gawin natin mas madalas yung ating mga media briefing on top of the individual interviews that we conduct with your respective media outlets. Lately, nung Friday ko, nagkaroon din mo ng release of memorandum circular kung saan po nagkaroon mo ng guidelines patungkol naman mo sa mga contract of service and JOs natin or job orders in the Bangsamoro Autonomous Region in Mindanao. Ilan po sa mga importanteng kailangan banggitin ay yung mga contract of service and job orders natin. Hindi na ho, especially yung mga nire-require na pumunta ho on a daily basis. In view of the COVID-19, sa guidelines po na pinalabas ng Chief Minister Ahod Balawag Ibrahim, they will no longer be required to report daily unless they are identified as part of the skeletal workforce o ng mga opisina. In addition, kung sila po ay nire-required or they will be identified as part of the special skeletal workforce ng ating mga opisina, they have to be given additional assistance such as yung pag-provide po ng mga disinfectant and that they must be given the assistance with regard to regular hand washing and yung iba pa pong mga social distancing or physical distancing measures. Itong memorandum circular po nito ay may retroactive application, meaning ho, magsa-start po ito ang implementation, ang reckoning rather, on March 15, 2020 or yung date ng beginning ng duration of community quarantine period. In addition, the contract of service and job order workers will not be required to report for work due to the work suspension, and those who are not part of the agency's skeletal workforce shall be paid their corresponding wages, salaries during the community quarantine period as exception to the no work, no pay principle for this occasion only. Contract of service and job orders shall strictly observe social or physical distancing measures in the workplace, i.e. maintaining at least 1 meter radius and practice personal hygiene like regular hand washing and proper sneezing and coughing etiquette. The contract of service and job order workers who will be required to work from home shall be paid corresponding wages, salaries during the community quarantine period. So ito po yung mga highlight nung memorandum circular natin on the interim guidelines covering contract of service and job order workers in the Bangsamoro Autonomous Region for the duration of the state of calamity and community quarantine due to coronavirus disease. Yung ilan pa pong mga mahalagang update patungkol naman po sa ating public health emergency ay maaari po natin i-direct sa Ministry of Health. Nandito po sa ating tabi ang head or the Ministry of Health, Dr. Santula Di Patuan, kasama po ang kanyang Deputy Minister, who is also a member of the Parliament, Dr. Zulkarnain Abbas, and yung isa pa pong very busy po ngayon si Dr. Usman sa Ministry of Health. Maraming salamat.